Good morning, peace be upon you. I am Professor Irfan Shukr, and today I am going to discuss in this video teaching session is multiple choice questions. It is very important to understand these questions because it has a huge impact on the students if the MCQs are flawed. Flawed MCQs benefit borderline or test-wise students at the cost of penalizing higher achieving students. That is injustice. If we talk about the outcomes of today's video session, it consists of certain questions which are frequently asked and providing answers to them. They include what are the differences between format, design and stimulus of a question, meaning by what are the components of a written question, what is the difference between one best type MCQ and one correct true MCQ, what are the stem, lead-in, options, distractors in MCQ, what is concept of theme in MCQ, how to construct a MCQ and how to improve the quality of MCQ. Let's start from the components. If you talk about the component of a written question, it has two components. One is the format and another is the stimulus. The stimulus determines level of knowledge domain of learning being assessed. Whereas the format determines the type of question, meaning by the stimulus determines whether the question is of recall, which is C1, or application and problem solving, meaning by C2 or C3. And it's the format which is going to determine whether the written question is a short answer question, short essay question, multiple choice question, and even extended multiple choice question, true false question, and so on and so forth. If you see a format or design of MCQ, it looks like this. For example, this is an MCQ. A patient gives history of shifting of pain to a right iliac fossa. There is rebound tenderness in right lower quadrant. The most common incision used by the surgeon to operate is called gridiron, B lens, C lower transverse, D lower paramedian. This is the design or format of a multiple choice question. If you talk about stimulus, stimulus means how much thinking a student needs to answer a question. Is he simply recalling the rote memory, which will be C1, or he has to think to bring into awareness the understanding of the question and then to use problem solving skills to apply on it. So it is C2, C3, C3 is application and C3 is problem solving. Let me give you an example of stimulus. The same question, it is written like that. The classical incision used in appendectomy is called out of the four. It is gridiron. For those who know the subject of surgery, this is simple recall of rote memory. So the level is going to be C1. What about this? A patient with history of shifting of pain towards right iliac fossa. There is rebound tenderness in right lower abdomen. The most commonly incision used by the surgeon to operate is called. Now you see, in this, the student has to think more because he has to reach to a diagnosis on the basis of history. So it is at a higher level of cognition. Even we can increase the problem solving level, C3 level, by changing the statement. For example, if we add the words, a female model who advertises two-piece swim suit, and the rest is same, then the answer is going to change to lens, because we know that is the profession and this is the only incision which can be hidden in the lower part of the swim garment which this professional is using. This was just to explain to you the stimulus. Now we have come to the format and design of MCQ. The same MCQ we take. Now if you see grossly, it has three components: 1, 2, 3. This is called as STEM. The question, this is called as lead in. And these are options A, B, C, D. So we have STEM, we have lead in, we have options. STEM is the information statement, if you think of. Lead in is the question statement. And options are the plausible answers, out of which one is the correct option, which comes the key, which you can call is the key, you can call it a correct answer, and rest are called as distractors. So options consist of a correct option, a correct answer, and distractors. This is the format or design of an MCQ. Now we talk about difference between one best type MCQ and one correct true MCQs. These pictures are going to give you an idea. This is one best type MCQ. This is one correct true MCQ, because let us say if these are option A, B and C, this is option A, B and C. In one best type MCQ, all answers appear to be correct. I'm talking about all answers appear to be correct. There is one correct true MCQ, all answers do not appear to be correct. One appears to be correct. Now, there is a concept of theme and sub-themes when we are constructing on MCQs. People use the term themes and sub-themes. Some says this is the theme, this is sub-theme, and in some literature they reverse this to be theme and this to be sub-theme. But if you talk about the meaning of theme, that means topic and subject matter. So I am not using the words of theme and sub-theme while describing the construction of MCQ, because using these two terms causes confusion in many minds. So let us get away with the words of theme and sub-themes. Let's talk straight away about topic. So this is topic of STEM, and STEM is the information statement. This is topic of option. So you have topic of STEM and you have topic of options. Now the problem is topic of STEM. We'll do it again. Topic of STEM. Now topic of STEM is the topic of the information statement. So therefore, the topic could be any. If you talk about clinical sciences, it could be name of an organ, it could be an organ, it could be clinical presentation, it could be any process. That will form the topic of an STEM. It means the information which is going to come in that MCQ is going to come from these topics. These are examples. The topic of options could be diagnosis, investigation, treatment, prognosis. It could be even structure, drugs, etiology, pathology, epidemiology, prevention, etc., etc. As I am going to proceed further, you're going to understand these things more. Lead-in is a question statement, so it must include question words like who, what, why, when, where, etc., etc., how. All these are question words and they should be included in lead-in because that is a question statement. You see, normal thinking pattern of a doctor is in a very sequence. From day one, when you start seeing a patient, first you ask patient what is ill, then you examine the patient, then you reach to a provisional diagnosis, and then you manage the patient. So therefore, first there is history and clinical examination, then you ask questions on the basis of data which you get on history and clinical examination. What is the diagnosis, when to treat, how to treat, who to treat, and these are all questions. And then you give answers about diagnosis, investigation, treatment, prognosis, etc. This pattern is hard fixed, hardwired into the brain of health professions. Therefore, while writing an MCQ, what they do is they write an MCQ information statement, then write correct answer, and then write the other options. So they write the stem, they write the correct answer option, and then they write other options. The first thing you should remember is there is a paradigm shift in thinking which you have to brought into yourself, and while writing MCQ, you think totally opposite. First write options and select an option. I've written the word homologous options because since all options are from the topic of the option, so therefore they are same homologous. Either the options are of diagnosis, the options are of epidemiology, the options are of treatment options, the options are of prognosis, or the options are so and so. They are homologous. So write homologous option and select an option without thinking much. Once you have selected an option, then based on that, write MCQ information statement, which is the stem, which only fits into that option. Once that has been done, now times come to write the question statement or lead-in. So have you understood this thing? Let me give you an example. So therefore, the topic is abdomen and the topic of MCQ is presentation of inguinal-scrotal swelling. Let us say this is abdomen, this is the inguinal-scrotal region. So the topic of the MCQ is inguinal-scrotal swelling. Without thinking, let me choose the topic of option. And the topic of option is diagnosis. Okay, now what could be these swellings? So it could be anything. It could be direct hernia, indirect hernia, femoral hernia, and so on and so forth. So it could be indirect inguinal hernia, direct inguinal hernia, femoral aneurysm, inguinal lymphanitis. I have written only 4 because this is an MCQ with 4 options. If there is an MCQ with 5 options, then you write the 5 diagnoses. After doing this thing, I am going to just take one answer. I have just chosen this one. Now on basis of this, I have written the stem. A 40 years old man has a swelling in right groin. The swelling is reducible and if the expense side comes with pearls, ring occlusion test is positive. And then on the basis of this, I have written the question statement, what is the most likely diagnosis? I have thought in totally opposite way. I have not done this thing that first I have written an MCQ, STEM, then I have written the correct answer, then I have filled in their options. No, that is not a good way. This is an excellent model, because once you have done that, then what you have to do is you have to choose another answer, another option correct, and change the statement accordingly. For example, it is same MCQ. I have chosen this one, indirect guanidal hernia is correct. The only change I have brought in the STEM is the ring occlusion test is negative. You want to go more? I have chosen this in guanidal lymphadenitis, and the only thing which I have changed is I have kept this sentence same. The swelling is firm, mobile and tender. So therefore, by doing this thing, you can generate a lot of number of MCQs in less time. To construct a good quality MCQ, it usually requires between 20 to 40 minutes if you're making a high quality MCQ. So therefore, if you have to make 4 MCQs, 2 on the 2, 2 to the 4, 4, 18, 2, you are going to require 1 hour 20 minutes to construct 4 MCQs. But by using this method, you will be constructing 4 MCQs in much lesser time than 1 hour 20 minutes. Then how to improve the quality of an MCQ? Let us say this is an MCQ. Ali scores well in exam because he understands the pattern of exam and has good time management skills. He is likely to have which of the following learning approach? Deep, smart, strategic, surface. Now what I am going to show is, I am going to show you a number of MCQs and you find out what can be done to them so that they can be made better. Now let us say, if you see this MCQ, then what is wrong in this? Now if you see except, the word except is used. If you remove this word, the quality of MCQ will improve. So therefore, the treatment is avoid usage of except. Ali scores well, he is likely to have which of the following learning approaches? Deep, smart, strategic, surface. This is an incomplete sentence. So therefore, if you want to improve its quality, then use complete sentences. Ali scores well in exam because he understands the pattern of exam and uses time management smartly. He is likely to have which of the following learning approach? Now if you see this thing, smart in both STEM and option, there is a verbal association between this word and this word. So therefore, avoid providing verbal association between words in the options, lead-in or STEM. Now, if you see this, what is with it? Now if you see this one, an outstanding student who won all Pakistan debates scores well in exam because he understands the pattern of exam and uses time management smartly. It contains unnecessary irrelevant information like an outstanding student who won all Pakistan debate. So therefore, avoid writing unnecessary and irrelevant material. What about this? Ali does not score the exam because he always understands the pattern of the exam and never uses time management skill poorly. If you see, their words are not, the negative word is being used, always never absolute words are used. Somehow or the other, if you take away these words, the quality of the MCQ is improved. Avoid using negative or absolute words. Now if you see this one, Ali scores not score poor in exams because he always understands the patterns of the exams and never uses time management skill. Very interesting. It is grammatically incorrect English. So therefore, use grammatically correct English, such an English which can provide even link with these together grammatically. What is wrong with this? Oh, yes. Options are not in alphabetical order. Somehow or the other, the normal tendency is the people like to keep the correct option in the middle. That is how the brain works. Or what they do is they make the correct answer longer. So therefore, place options in alphabetical order or numerical order. This way, a randomization is made in an excellent way. So therefore, if I summarize it, these are the questions. Once an MCQ has been constructed, one should give answer to them. In case of STEM, is the question related to the topic from the blueprint of the examination? The answer should be yes. Is the language easily understood and grammatically correct? The answer should be yes. Is the STEM written at an appropriate level of difficulty? The answer should be yes. Because if you're writing a recall, then it should be, the difficulty should be of a C1 level, the stimulus should be of that type. If it's a problem solving, then the stimulus should be more. Can the question be answered without looking at the options? Yes. Rather, can the question be answered without looking at the option? Yes. Was a clinical case used as the basis for judging? Yes. This is important, especially in health professional education, where you are using clinical cases. Is the STEM free from irrelevant material? Yes. Does the leading question clearly indicate how to answer the question? Yes. As for option, is there one clearly correct answer? Yes. Are all the distractors plausible to a weak candidate? Yes. This is important for one best type MCQ. May not hold that much true for one true or correct type of MCQ. Are all options homogeneous? Yes, it means all options are from the same topic of options. Are all options of the same length? Yes, as I told you, somehow or the other, students read this thing and the examiners, in order to provide an answer correct, they increase its length. Were terms like all of the above and none of the above used? No. Were any imprecise terms frequently, sometimes, often used? No. Is any word from the STEM repeated in options acting as a clue? No. A very easy way would be to have a key like this. So after constructing the MCQ, just keep it in front of you and tick it to ensure that all things fall into yes. I hope this lesson helps you in understanding the MCQ. Have a good day. Keep smiling. See you again in the next video.